Now we get to look at another mode of imaging. So this mode of imaging is what is known as the 18-fluoro 2-deoxy D-glucose. They usually abbreviate it as the 18-FDG. So it's used in what? PET scan. That's a positron emission tomography. So look at it, look at the properties, and also have a look of how images taken with this enhancement looks like. So the first one is the images even. So I have another one. So let's digest some discussions so you get to look at the other one. So it's actually the most widely used radiotracer in positron emission tomography. It acts as a glucose analog. So it will highlight areas of increased glucose metabolism. So it makes it very important in cancer business. Okay. So what is it? The chemical nature is a radiopharmaceutical where the hydroxy group at the C2 position of glucose is replaced by what? Radioactive fluorine 18. So it will be transported into cells via the glucose transporters to be phosphorylated by the hexokinase. So unlike normal glucose, it cannot undergo further metabolism, so it becomes trapped inside the cells. So the PET scanners will dictate the positron emissions from fluorine 18. It will now map metabolic activity. So it will now show you how bone activity is going, or maybe show areas of high inflammation. You understand that kind of thing. So clinical indications, it shows what dictates malignant tumors. You can differentiate between a benign and a malignant tumor. You can even stage cancers of lymphoma, of the lungs, of the colorectal, and of the breast. You can also use it to monitor treatment. As you are treating the patient, you want to see how it is coming up. Also using to evaluate neurological issues like all this epilepsy, Alzheimer's, Parkinson's. Also identify hypometabolic or hypermetabolic regions. You understand? All those bone. Okay. Also access myocardial variability in ischemic heart disease. Also differentiate scar tissues from hypernating myocardium. So that's it for the 18-FDG.